To the side. I swear I'm not on my phone. I'm looking at notes.
Oh
Okay.
yeah, no, that's
Okay.
completely fine.
Okay. So I wanted to ask you first about your research on racial discrimination on brain health. So how does that work,
Yeah,
basically?
the way at least many people before me have conceptualized discrimination is that it's a form of a chronic stressor. And we
Mhm,
know from a lot of the research on brain and behavior that chronic stress, that is stress that is prolonged and
mhm,
often perceived to be uncontrollable, that can have detrimental effects on the brain. And it really depends on what area of the lifespan we're talking about. So there's early life adversities that have certain effects on the brain, and then chronic
mhm,
stress in later life, older age, that can also have an impact. So just racial discrimination is something that I am particularly interested in because unlike other forms of chronic stressors, there's really not anything that you can problem solve about it. So
mhm,
it's not like you can change how people are going to potentially treat you because of your racial or ethnic identity. And
mhm,
because of that, those who have experienced discrimination are often sort of walking around, if you will, with this anticipatory anxiety, not knowing
mhm,
when is going to be the next instance that somebody is going to, you know, discriminate in some way.
mhm,
Now, in terms of the brain, we know that there are certain regions that are involved in trying to manage anxiety. Um, a lot of the research has pointed to the anterior cingulate cortex. That tends to be sort of an area that's really active when somebody is in an anxious state.
mhm,
The prefrontal cortex, so it's sort of our, higher order functions. It governs our ability to plan and organize and anticipate consequences, all of those things, and to help to manage emotional states. We know that that
okay,
area of the brain is also implicated, as well as regions that tend to be responsive in um, threat responses. So the amygdala, for example, is sort of our brain's, fear center, our emotional response center. And so
mhm,
those three regions, I would say historically have been across the research implicated in its relation to chronic stress generally, but also in the context of racial discrimination.
okay. And would you say that, like, at what age do people start to realize that, "Oh, what's happening to me is racial discrimination," and when do you process that?
That's a good question. I think it's different for everybody. I think the in versus out group happens very young. And I think that
Mhm,
that noticing of differential treatment happens at a very young age for most kids.
mhm,
They've done experiments like way back in the 60s where they were able to sort of experimentally manipulate, in groups and out groups, and kids were actually very responsive to that if they thought they were part of the
mhm,
in group or the out group. Now, I think in terms of understanding what it is and being able to assign a label about this is discrimination, that probably happens a lot later. And that is
mhm,
often learned by society. So how much that's discussed by parents or if it's taught earlier on, that's going to vary by individual. But I think the awareness that one is not being treated equitably happens pretty young.
okay. And, sorry, I was gonna ask also, do you think, like, if a kid is growing up and their parents, like, tell them early in life, like, "Oh, like, we live in a society where this happens, and you're gonna face it one day." Do you think that'll help them prepare and it'll maybe become less of a stressor for them in their life?
I
Like
think it is helpful to be aware, but also to couple it with how to, despite that, how to maintain sort of pride in your ethnic or racial or cultural identity. So
mhm,
it's good to be aware, yes, but also to bolster, what are the positive things about one's identity? Because we know that that's very protective
Mhm.
against the effects of stereotypes, the effects of discrimination. So, yes, if people are aware that this is something that happens,
Mhm.
here's how you can understand the nuances of behaviors that
Mhm.
may seem out of the norm, but also how do you cope and deal with it? And how do you still maintain a strong sense of self? That I think has to be imparted very early on.
Okay. And then you also I mean, I thought this was really interesting how, um, it literally affects your gene expressions. Is that like how does that work?
Yes, so so my colleague Steve Cole, who
Mhm.
is really done a lot of work shaping the field of social, what we call social genomics. And it's really
Mhm.
about how do certain genes that are involved in innate immunity and the stress response, how do those genes transcribe or how do they express themselves essentially? Because we can have genetic predispositions towards
Mhm.
certain diseases. All of us have, certain predispositions for things, but whether or not that's ever going to manifest or come to light is really a lot. It's heavily influenced by the environment.
Mhm.
So social genomics looks at how does the environment interact with the genes regulation and expression. And
Mhm.
what we know is that from populations who historically feel isolated, who feel marginalized, that they have a different gene expression profile in that the genes that are involved in coding for inflammatory responses, those tend to be upregulated, whereas
Mhm.
those that are involved in coding for antiviral responses, which is fighting against the disease, and illness, that those genes tend to be downregulated, and genes that are involved in like stress signaling responses throughout the body are also upregulated. So there's been this pattern that in populations who tend to be socially isolated or marginalized, that you see this what we call conserved transcriptional response to adversity. And so we looked at it a few years back, comparing Black Americans and white Americans on their gene expression profiles, because we know already that Black Americans tend to have higher inflammatory states. So if you look at peripheral inflammation, it tends to be higher in comparison of Blacks to whites. Now, why that's the case, there's a host of reasons that people think that might be the case. But what we wanted to look at was specifically if you look at the gene transcription of those genes that are involved in inflammation, does discrimination explain any of the black white difference? And that's
Mhm.
essentially what we found, because we looked at other forms of life stress, we looked at socioeconomic status, all the reasons that historically people have thought that why black Americans have higher inflammatory states than white Americans. We actually were able to look at that in this study and really
Mhm.
isolate the effects of discrimination.
Okay. So so basically being discriminated does affect your mental abilities in a way.
Right, because when you are discriminated against, it's going to set off a stress response in the brain,
Mhm.
and there's a release of hormones that happen when we're stressed. It's really our fight or flight response, right?
Mhm.
So, in the events of discrimination, it is a threat, it's a social threat, and it's a
Mhm.
threat against potentially, and if you think about it from an evolutionary perspective, people who are ostracized or marginalized are less likely to be able to have access to resources in the future. So
Mhm.
that is a clear threat to one's mortality. If you can't access resources, then that's a threat to your livelihood. So at a very primitive level, if we think about how does discrimination operate, it operates in that fashion, in that somebody's going to be excluded from opportunities that they may have received otherwise.
Okay. And all of these research studies have been done on adults, right? There hasn't been anything
These
on kids?
studies have been done on, well, the ones that are looking at gene expression, yes. I'm not aware, although I don't know all the literature, so, but I haven't seen anything come out in children, although it's a
Mhm,
very interesting question. I think, for one, at what age do they start to notice the
mhm,
differences? And does that at all affect the way that their genes express themselves? We know about intergenerational trauma. So, children who come from families where there has been historical trauma, that there have been groups that have looked at, does this gene expression pass on to their offspring? And there has been findings that it indeed does. But in
okay.
terms of taking that out of the equation, just looking at pure discrimination experiences, that I don't know.
So, it's been proven that, like, let's say your parents went through racial discrimination their whole life and they have kids, that kid is, like, gonna have like, the genes will be passed on and it'll have the same effects on them, basically?
I'm not sure if it's about discrimination specifically, but I know that any forms of trauma,
Trauma.
and it's yeah, and there has been some really good work looking at kids who have been, born from parents who have had, historical trauma, and thinking about sort of how does that get passed down intergenerationally.
Okay. And then I wanted to ask you about you published an article in 2023 about social media and
Oh, yes.
adolescence. Yeah. So I wanted to ask you, like, what did you find about how it affects adolescents?
More of an opinion piece, because
Mhm.
one of the things that I have been interested in is sort of how does stress affect the adolescent brain? And I'm not the only person interested in this topic. There's been a lot already done in
Mhm.
this area, but I think social media is relatively new, in terms of its multifaceted effects, because social media can be a good thing, right?
Mhm.
It's, you can promote, positive educational messages. People can feel like there's a sense of community. So there are good benefits to it, but then there is this dark side where I think we see, this increase associated with social media use, with depression, anxiety. And what I was interviewed about and discussing was thinking about, how the adolescent brain is still developing. We know that the brain develops until about age 20. And,
Mhm.
the way the brain forms is that the emotional centers, are developed first, and it kind of comes outward to the prefrontal cortex. So the ability to make decisions, to reason, to be able to manage emotions, all of that comes later, in late adolescence and early adulthood. So
Mhm.
you have to think that when you're an adolescent, that is a time, not just neurodevelopmentally, that the brain is making these rapid changes, but you're also trying to figure out who you are and where you fit in.
Mhm.
And social media, it can be misleading, right? Because people are not going to post their real everyday lives. They're going to post when they're on vacation. They're going to post the things that are enticing or exciting to somebody else. So
Mhm.
it could feel like one is isolated, in that other people are having all this fun and I'm just living this very boring normal life. And so in that sense, there can be this feeling of being on the outs, if you will, of what's
Mhm.
happening in the world, when we know that, this is not accurate, but the adolescent doesn't necessarily comprehend that yet. So also, in terms of body image and identity, we know that there are many ways in which people can alter their looks using filters and all these apps that are available. And especially now with AI, I mean, pretty much you can look like anybody you want to, but
Mhm.
on social media. And so we know that, this sense of a non-reality is stressful for
Mhm.
adolescents. And we know that it can impact the way in which they make decisions, and it impacts their mental health. And so this
Mhm.
is something I'm very concerned about, because particularly after COVID, I think we saw the effects of what social isolation can do. And we
Mhm.
also saw increases in the rates of suicide among youth. So when you couple that with isolation away from others, your only communicative outlet is social media, and you're looking at, it can really have a detrimental effect on mental health.
Mhm. I think it's like really interesting because social media has like two radical poles. One is like encouraging very bad things like eating disorders and like that type. And then the other pole is like, oh, look, I have a perfect life and like you should be like me. So there's no like real in between where people are exposed to like actual real life.
Right. And
Yeah.
that's because if we think about, let's just put social media aside for a second. Think
Mhm.
about television shows, think about movies.
Mhm.
Television shows and movies and reality shows have historically always been designed to tap into, what people are going to be interested in. They're going to
Mhm.
be interested in seeing things that are either shocking or that are very pleasant,
Dramatic.
dramatic. We don't really want to see the norm. So you
Mhm.
don't just know. I don't really know of many shows or movies that have that have received interest if it's really just showing a person's mundane life, which
Mhm.
most of us actually have.
Mhm.
But we always want to see the flash and the pizzazz, which is where the attraction of reality shows came in, right? Because now you have
Mhm.
people showing their big houses and all the fancy things that they have. That's what people want to see. But in that, it starts to become, oh, everybody has this. I don't. And
Mhm.
it can appear that you're the only person in the world that doesn't have X, Y, and Z, and that translates to social media.
Mhm. So the problem really is like everyone loves entertainment. It's been a thing for centuries, right? But the main problem is that it's being exposed too early, right? So like children who we don't like our brains aren't even developed. 13-year-olds are online, like digesting things that they shouldn't really be knowing about, right? So it's more like age is a huge issue.
It's a huge issue, and
Mhm.
I didn't grow up in the era of social media, but I know that when I was a kid and I watched movies, you knew those were movies and it wasn't real. You knew
Mhm.
that they were characters. You just knew that. You look at
Mhm.
magazines and you just knew that, okay, these are supermodels, in these magazines. It wasn't like it was everyday people that
Mhm.
were airbrushed and all that. So that's the difference between how it was, for example, when I
Before.
grew up versus now, because now it feels like, oh, everybody's got this fabulous life. And, or like you said, the dark side of around eating disorders and all of that is promoting those kind of
Mhm.
behaviors that are really dangerous. And without any education around it or controls or reality checks, it gets really dangerous.
I wanted to ask you if you're aware, do you know the website looksmax.org? Have you heard of it?
No, I don't.
Okay. So, like, if I ever in the future was in research, I would research about this because it's so interesting. But it's a website of it's only allowed for men, and it's basically young adolescents who are trying to improve how they look. And any female is not allowed on the website. And they promote
Oh,
techniques. Yeah, they promote techniques like hammering your face until your bones break so they grow back stronger and you have more stronger more stronger bone like features. I don't know. So
oh, wow.
yeah, I just found it like a month ago and it's
Looks,
crazy.
look, it's LOOKS.
S M A X.org.
Wow. And so
Yeah,
how do they know, how do they monitor if you're male or female to get on the site?
there's like I already got blocked. I'm off of it because they have admins. They have admins and they can basically they can tell from how you talk if you're female or male. It's crazy. I don't even know how they
Wow.
figured it out. Yeah, it's
Wow.
crazy. I know. So I was on it for like a few days and I saw people telling other people like you need to go to Turkey, get like height maxing surgery. They like growth like they stretch your bones until you grow 3 inches.
My
And
gosh.
I know it was shocking. So that's really interesting to me because I feel like we don't talk about males and their insecurities a lot. It's always like
Oh,
woman. Yeah,
wow. That's now that's
shocking.
yeah, that is shocking. And this
Mhm.
is where yes, I can only imagine how many of these sites that are out there that are telling
Yeah.
people really harmful things, physically
Mhm.
that down the road can have implications for health.
Mhm. It's crazy. I
Well,
I just
thanks.
wanted to
Now,
bring it
now
up
I want to
here.
try to look at it, but I have to figure. I should have a male look at it for me.
If you make an account, mark yourself as male because 'cause they'll kick
Yeah.
you out. Yeah.
Okay. Wow.
And yeah. And then I wanted to ask, is there like do you think kind of a mix with like what we just talked about with discrimination, do you think like people of color are more likely to be affected by social media than like other people?
I think yes, I do think so. And then the reason I'm hesitating is because I'm trying to think, in what way, right? Because
Mhm.
in some ways, I think social media, is going to impact. I'm not. I'm going to say it's going to impact those who are in a lower resourced
Mhm.
community or lower socioeconomic status. And
Mhm.
those who tend to be people of color. And the reason is because, again, it's this haves and the have not
Mhm.
dichotomy. And I think that that is more of a detriment to people than necessarily like specific to skin tone. Actually, social media might be more positive for people of color because you actually have role models that look
Mhm.
like you and sound like you. So I could see that being a benefit in some of this. Um,
Mhm.
back in the day that beauty, for example, you had to have certain features that were
Mhm.
Western oriented white features in order to be considered, the standard of beauty. That
Mhm.
has changed dramatically about what the standard of beauty is. And I think that so in that sense, I think that's a positive, if you will.
Mhm.
I do think that um, people of color are having more opportunities to express their talents on social media, whereas they may have not been given that chance. Like if we didn't have social media and it was just television, for example, who's
Mhm.
likely to be able to go on to get into television? It's people who are often already part of that environment, the entertainment world, which
Mhm.
historically has not been people of color. So in that sense, I think it's growing. On the detrimental side is this have not piece where feeling like everybody's just taking trips to Tulum every week. If
Mhm.
you're someone who's, struggling financially with resources or your family struggling, that can feel very isolating, I think, because nobody's going to show on social media the poverty that they're in.
Mhm. Okay. And I was gonna ask you, do you know if there's any like particular stage in life where interventions could be most like effectful, like regarding social media?
I think it should be early. I think it
Mhm.
needs to be just like our understanding of television and movies is that
Mhm.
historically it has been we know that we know it's not real. We know these are characters. We know that it's not reality. I
Mhm.
think that has always, been taught very young. And
Mhm.
so, again, I'm sort of thinking that I'm an N of one, so I'm sort of going based on my experience, and I'm biased in that sense. But I remember there was a time when I thought TV was real and the characters, and I was taught very early on that it wasn't. So I think social media needs to have the same level of education. And
Mhm.
I'm not sure at what level the intervention is. It with the school? Is it obviously the parents? But do schools need to implement this more? I don't know. And that's where I think people who have expertise, in how do you develop community level interventions to tackle this problem, I think that's really needed.
Okay. And then I didn't do much research about this topic, but I was wondering if you could talk a little about the HIV and its sociological effects on people.
Well, historically, so if we go back to how HIV was back in the 1980s,
Mhm.
there was not the advancements of medication that we have now. So people essentially, by the time they had a diagnosis, they maybe had 6 months before they passed.
Mhm.
And it back in the day was a very scary disease, because even when the first antiretroviral medications, AZT, came in place, people had to take like 30 pills a day, and they were very toxic to the
30?
body. Yeah, like
Oh my god.
yes, it wasn't like one pill, and so, and the AZT, antiretroviral medication, was highly neurotoxic to the brain. So, but that's what people were on. And so you
Mhm.
have people who are long-term survivors who have, because they the HIV was caught during the time that we have medications, but because of the immunosuppression that happened for a prolonged period of time, we're seeing people in older age having other medical comorbidities earlier on if they
Mhm.
have been living with HIV. So the how it affects the social piece of it is that we're seeing medical conditions that would normally not happen or present itself into somebody's elderly happen very young in somebody who has been living with HIV. And when I say young, I mean like 50, because if we think about certain medical conditions like dementia don't emerge until after 65, to see cognitive problems in people in their 40s and 50s is early. Um, Now I would say that although medications have advanced, people can achieve viral suppression, which means that they're not shedding virus. It's still a
Mhm.
highly stigmatized disease. So, from a mental health standpoint, it's extremely important to look at social isolation in this population, because if we think about discrimination, it's not just because of race.
Mhm.
Discrimination happens from all forms, and HIV is one where the stigma is still huge. It's unfortunate because even though HIV is really just like any other chronic medical condition that one has to live with and manage, it's not seen at the social front in that way. We're
Mhm.
not there yet. So, from a mental health perspective, particularly as those who were long term survivors who saw friends of theirs die in the epidemic, that is something that I think we need to be mindful of moving forward.
Okay. And I wanted to ask, I forgot the name, but they're encouraging now for at beginning the age of 15 for teenagers to take an injection for an STD. What is it called?
For pre exposure prophylaxis.
Yes, I
Yeah.
think so.
Yeah,
Um,
so that is so PrEP, the idea of PrEP is it's essentially antiretrovirals that you would take before, you could potentially contract HIV.
mhm,
Now PrEP is really only recommended for populations who are at high risk for HIV. This would be, for example, I work globally, so I'm thinking about our study in Uganda where, they've looked at sex workers, for example. That would be a population, if they have not been exposed to HIV, PrEP is usually a good idea because it could protect. When used, it's very effective. The problem
Mhm.
is that a lot of people don't know about it. They're worried about taking a medication before they technically need to.
Mhm.
Um, but we really need, for high risk populations, and not just, sex workers, but people who are engaging in risky sex, period, or intravenous drug use. We need to think about, PrEP, because those are the ways in which STDs are contracted.
And what age would you like would you start in your teen years for the prep or at
I
what
think
age?
it depends on, I'm not sure because it's a little bit out of, I would defer to people who are really, knowledgeable about the PrEP research.
Mhm.
I think that most of the studies that I've seen, the
Mhm.
interventions have really targeted, I think the youngest has been around 18,
18.
young adults who are engaged in risky sex. I don't know about earlier than that. I don't know what
Mhm.
the implications are. My sense is that we need to prevent, disease, and but what the long-term effects of that might be, like starting, say, an adolescent on PrEP at the age of 12, that I don't know.
Okay. And then just going back to the social media topic, um, are you aware of like digital like mental health tools like um what is it called?
Like the Calm app.
Yeah, yeah, those. Do you believe in them? Like, do you think they actually do help mitigate like risks about social media?
I think, well, I think those apps are designed for primarily like depression and anxiety. I don't
Mhm,
know of any apps that are out there that are designed to treat severe mental illness, like let's say
mhm,
schizophrenia, or, but a lot of the apps out there have, I mean, people say that they help, right? So,
mhm,
to some degree, but there are very few that I know that have been, I think there's one that will be coming out that's actually been endorsed by the FDA.
mm,
And that
okay,
is, only through communications that I've had with others that I'm aware of, that really has been, a state of the art, tried and true tested app for depression. But there are those out there, and we recommend them, for patients. I don't think it hurts to
mhm,
use an app. If it works, it works. It doesn't really matter if it's been endorsed by any particular governing body, if it works for the person. The danger, though, is sort of sparking false promises, if you will. Like,
mhm,
I wouldn't want someone to think that this app in of itself is going to cure any particular mental health problem. I think
mhm,
that the way apps should be used is in collaboration with your doctor, your psychiatrist, or your psychologist,
yeah,
because there's a few things that need to be considered when somebody is suffering from a mental health issue. One is whether or not medication is needed. Sometimes medications generally are can be very helpful, and especially in combination with psychotherapy of some kind. So if
mhm,
the therapist is using the app as a way to help the patient when they are not in session, I think it could
mhm,
be extremely effective if there's like a way to use the app in conjunction with psychotherapy and medication management. So I
okay,
think that it will grow as an area, because the good thing about these apps that has historically been a limitation of psychotherapy is that it doesn't it doesn't reach those hard to reach areas. And the
Mhm.
people who are the poor and the uninsured or who live in rural areas,
Aren't receiving the best
they're
treatment.
not receiving it. And
Mhm.
so this could be a way where everybody, where it promotes equitable care.
Okay. And my personal opinion on these apps is that I think with, like, the growth of AI is that people are gonna become too dependent on technology for everything, and then maybe at one point we're gonna forget how to communicate with people, like, the whole point of having a therapist, right, is to talk one-on-one with a human being. So,
Right.
I think that's, although it could be good, there is harm in the fact that you're still using an app and on technology.
Oh, yes. I mean, I think that that goes across the board, right? That back when I was, growing up, there wasn't text messaging. So if you wanted
Mhm.
to communicate with someone, you had to call them on the phone. You had to ask them what time they would be home and call them at
Mhm.
that time, or they had to call you at that time. If you were not
Mhm.
there, you didn't talk to them. There was no other way of communication. Now, there is very few times that people actually talk on the phone anymore.
Mhm.
Everyone texts messages, everyone sends emojis, everyone
Mhm.
sends, hugs, it's not a real hug. And I think that there is this human connection that slowly over time with technology is becoming lost. And I do
Mhm.
think that accounts for a lot of the depression that we do see. So I agree completely that as we think about technology, as great as it can be,
Mhm.
we it shouldn't supplement learning like actual material. Like I know AI, you can write a research paper in a day, based on
Mhm.
just typing a topic and asking it to write a paper. But that takes away the beauty of actually reading and delving into something that you're interested in.
Mhm.
And I worry about that. That's a whole separate thing. But I do worry about that piece of learning, education, everything becoming lost and dependent on technology.
Okay. And do you think in the future technology will take, like, a positive turn or a negative one in terms of mental health?
My hope is that it would be positive.
Mhm.
I think it can only I will say now a colleague of mine at UCLA, Dr. Alexander Young, was just funded to do this large study of looking at outcome measures for mental health because
Mhm.
historically you go to a therapist and you don't really know how effective they are, right? A lot of people kind of shop and they see who they connect with, and that's kind of how it works. But we don't really know the effectiveness of that
Mhm.
therapist on patient care. And there
Mhm.
is this push through the National Institute of Mental Health and others like Dr. Young who are actually working on ways to quantify and think about how do we look at the outcomes and look at quality of mental health services. So that's happening on one end. I think on the other end we
Mhm.
are having FDA approved apps for mental health that are designed to be used in conjunction with psychotherapy or other forms of mental health treatment. That's a positive spin. So I do have hope it's going in a positive direction.
Okay. And just the last thing I wanted to cover with you, I wanted to talk about COVID and what you found about how it's a neurological disease. So
Yeah, well, I mean, I didn't find that, but I mean, because I didn't do the research, but there have been people that have really looked at, how does COVID affect, the central nervous system, and we know that it does. What I see in my clinic practice is a lot of patients who have had COVID and they have cognitive problems that are resulting long after they no longer test positive for COVID. And we call it long COVID, and it's associated with what people call brain fog. And the way it's
mhm.
described is just that they're not thinking as efficiently as they used to think or be able to problem solve. And it's really had an impact for some people on their ability to carry out their job. So
Mhm.
it's a disability that we're seeing in clinical practice. The mechanisms by which COVID affects the brain is thought to be a lot similar to how HIV affects the brain, which is that, it basically traffics through the blood brain barrier and is able to set off neuroinflammatory responses. People are
Mhm.
thinking along similar lines around COVID. But I think the research is still new. We don't have a ton of information
Mhm.
about the mechanisms of how COVID is affecting the central nervous system, but we know it does, at least from a clinical side. We see these patients who are having cognitive issues.
And these are people who had COVID, like, back in 2021 or recently?
It's people who've had it recently. Initially, it
Mm,
was thought, well, the COVID had to be severe because it was
mhm,
only seen initially with the severe cases back in 2020 with the neurological conditions, but now we're seeing it even after that. We're seeing that people
okay,
are reporting, sort of long-term cognitive issues. So we don't really know why yet, why some people might be more susceptible to brain fog versus others. At
mhm,
least I'm not aware of the research, but I think that is still underway.
okay. Um, so yeah, that's all I wanted to ask. Sorry if I went, like, a
Okay.
little off track.